Sleep apnea and sleep issues are two entirely different animals that you need to consider. There's a reason why, when people are doing these big research studies on how melatonin affects sleep, they're actively excluding people with sleep apnea. It's because there's special considerations for sleep apnea that you need to be able to understand and appreciate so you know when melatonin is a good idea and when it's a bad idea. So that's what we're going to cover today in today's quick video. I'm Dr. Dylan Peckus. Thank you so much for joining me here. And we're going to go over what melatonin is, what it does, what the research says, the different effects, and how you can use it safely. So first, melatonin, for those who don't know, it's a molecule that your brain makes that helps you fall asleep. That's as simple as it is. It helps you fall asleep and it helps you stay asleep. It is a marker of your body's circadian rhythm and circadian health. If your melatonin levels are nice and high and they're released at the right time, your body has a good circadian rhythm. If it's too low, or if melatonin is secreted at the wrong time, then you have a bad circadian rhythm. Chances are you also have bad sleep as well. The reason this is very important to know because people with sleep apnea, from waking up so many times in the middle of the night, this actually hurts their body circadian rhythm. So if you compare people without sleep apnea, which is on the top, to people with sleep apnea, which is on the bottom graph here, people without sleep apnea have more melatonin. They're about 70, whereas people with sleep apnea, they're more around 45, 50. So quite a bit less, and that's going to contribute to worse sleep quality. And in case you're wondering, does using a CPAP improve your melatonin at night? That's also what this study looked at. No, it doesn't. Yes, these numbers look a little bit different, but there's not a statistically meaningful difference between those two. So just because it looks different doesn't mean statistically it does not mean that they are truly. Now, the other very important part that they learned in this study is that when melatonin levels go up at the peak here, that's actually when you have the most apnea events. And that's really important to know because we're going to talk about some other factors of why melatonin may not be safe before we talk about when melatonin might be a good idea. So, the reason I mentioned that when melatonin peaks in someone with sleep apnea, they have even more apnea events, they stop breathing, or they have more snoring. That's because, and I'll spare you the details, I'll give you the highlight of this article, is that melatonin will actually relax your muscles. That's something good if we want to relax, but if we're trying to keep our airways open and if we have our tongue relaxing, our soft palate relaxing, the muscles in the back of the airway relaxing, that's all going to be collapsing in the back of your throat because it's going to be pulled by that fast inhale that's happening in people's sleep apnea. That fast or regular inhale is going to pull those weak, relaxed muscles into the airway and close them off and cause problems. You'll stop breathing or have snoring or both. And that's why when we're looking at melatonin for someone with sleep apnea, it's not a great idea in this scenario. Taking it ongoing, because every single time you take it, that melatonin pill will lead to much higher concentrations than you would have naturally. And this will lead to more airway collapse. And this is why many times when I'm working with people, whether it is we're looking at their sleep data or they're telling me how they're feeling in the morning or what their partner is saying about their sleep, pretty much every single time, objectively and subjectively, when they're on melatonin, things are worse. They stop taking it, things get a little bit better. And a big part of that is going to be this mechanism. Now, the other one that's very important is that melatonin, which is represented by these MT subscript 2 receptors, melatonin will actually reduce the amount of nitric oxide, which is very important. It will reduce the amount of nitric oxide in your body. Now, we want a lot of nitric oxide because it improves the oxygen in our tissues, it helps us get more blood flow, it helps us breathe more easily. So, if we take melatonin, we have less nitric oxide, and then as a result, it will be harder to breathe through your nose, you're going to mouth breathe more, and that's just bad news bears for your ability to breathe well and sleep well at night. So, that's another strike against melatonin on a long term basis. This is just long term. This is what will happen over time, and the effect builds on itself. Now, the other thing is that melatonin will also lead to insulin resistance when you take it on a long, ongoing basis, especially in these high doses you see where people are taking 5, 10, 15, 20 milligrams. It's going to lead to these other consequences. Specifically, melatonin will hurt your body's ability to use insulin correctly. Then, as a result, your blood sugar levels go up, and then weight piles on. And if you already have diabetes or pre-diabetes, things just get worse and worse and worse because of this connection if you're taking melatonin. So melatonin makes many things worse in sleep apnea, and it's not worth the trade-off on an ongoing basis if you take melatonin every single night. However, you can consider it in some scenarios. And I like to think of them all as these resets. Maybe if you went traveling and now you have some jet lag, or maybe if you had a few rough nights of sleep and you want to use it once to kind of get back into a better rhythm, that's the appropriate use for melatonin. And the big goal is to use as little as you can to get the effect. Because the more is not the merrier, as we've learned, whether it's insulin, nitric oxide, or your muscles relaxing. You want to use as little as you can. I'm talking about those 0.3, 0.1, 0.5 in the decimal range of that milligram dose. That's going to be more appropriate given what we considered. Now, if there is a way in which you could improve your sleep and doing it in a way that's not going to cause all these different issues for your sleep, and in fact can lead to many systemic benefits, that would be awesome. And that's exactly what we're going to talk about next with vitamin D for sleep apnea. So if that's available, go ahead and click on the screen. I'll put the video there. If it's not, make sure you subscribe so you do not miss that episode or any of the other awesome content that we're putting out. And of course, if you're someone who wants to be sleeping well as quickly as possible with the highest level of confidence and just be done with sleep apnea once and for all, then I really encourage you to reach out to us and get your free one-on-one evaluation session where we're talking about your issues, your goals, and if we can be the people to help get you there. So that is ochnow.com/talk, or there should be a button that's been above my head for a little bit. Either way, thank you so much for watching, and I'll see you soon.